James. Dr. Tan Chong TIen is one of my teachers. So he graduated in 1974, and he was director of the spine service in the General Hospital for 10 years before he left for private practice in 2005. And he was also a past president of the Orthopedic Association in Singapore, and also visiting professor in some universities in China also. So he's a very recognized name in spine surgery. He'll talk on the low back today.
Good afternoon. I appreciate you all coming over to listen to us in the afternoon. It's better to spend the time sleeping, isn't it? The fact that you all come here, I really appreciate you all. Now, what Dr. James Tan has spoken to you all just now, a lot of the principles also apply to the low back. Now, I think this is okay. As you know, low back is an extremely common condition. How many of you has got back pain? Oh, I see, you can see that. But I think by estimation, I think 80% of the population do experience back pain sometime in their life. So this is how common this is. Now, my purpose this afternoon is try to explain to you the causes of back pain, most of the back pain, right? Now, and hope that you can understand the. How do I advance this? Not sure. Okay, thank you. Now, 80% of the back pain actually is degenerative causes. Now, the other 20% is caused by the trauma, like accident, fall, infections or tumors. Right? Dr. James Tan has highlighted to you and shown you some pictures of the infections and tumors. So I will not concentrate on this anymore. I will go on to describe to you these main causes of back pain, 80% of back pain. I'll briefly mention to you, how do you know you have tumor or infections? I think the type of pain, whereas this tumor and trauma and infection are very serious conditions, right? They can be fatal if not treated. Whereas the 80% degenerative conditions are benign. They can cause you a lot of disability, but they won't kill you, right? So it's important to know, to be aware that when there's symptoms, what kind of symptom is could be due to tumor infection. Now, tumor infection, the pain, they are very severe. They get worse and worse and worse. All right, and it may cause weakness and dysfunction of the limbs. And the infection, you can also have fever associated with the infections. So if the back pain is getting really worse, and you have fever and has also deficits, and that could be pointing to having infection or tumor, and you must not delay, you must go and see doctor straight away and have it diagnosed, right? Because they can be fatal. Now, whereas this 80% of degenerative condition usually is very chronic. Usually it's go on and on. You can have neck pain, back pain go on for years and months and years, right? And it can cause you great difficulty in walking, but it won't kill you. Right? So I am going to describe to you these 80% of causes of low back pain. Now, since Dr. James Tan has already mentioned the structures in the spine, I'll just briefly go through. As you can see, that the spine consists of many pieces of vertebra joined together by the disc, and the nerve system is very intimately connected to the spine. So any problem in the spine can also cause nerve problem. So this is also the cervical spine. Now, basically the degenerative process of the lumbar spine, we can divide it into 3 stages. The early stages, middle stages, and late stages. Now, early stage, we mainly see is the degeneration of the disc. This most of the time happen in the age from 20 years onwards, 20 to 40 is the most common group of patients that we see. Right? They present with back pain, sometimes slip disc. Now the second stage starts from about age 40 onwards. I mean, this is still ongoing, even after 40s, it's still ongoing. But from the age of 40, you start to see this facet joint problem. This is facet joint. This joint, small joint at the back. This small joint at the back is called facet joint. Now this gives rise to another set of problem. Now the third stage is when you come to the 60s, 70s, and beyond that, then the problem of bone failure comes in. The bones start to get very fragile and you can get fractures. So these are the three stages of the degenerative condition.